So many different planes and views when we scan the liver. A little bit complicated, isn't it, Christian?
It is, but I think we will manage it.
Yes, because we'll show it to you in 3 different ways. After showing the planes and views on the torso, we will see it now in the video clips and photos, and then show you in a live model demonstration. We place the transducer into the epigastric area in the median position and get this view over here.
Okay, so we detect liver parenchyma over here. There is the inferior border of the liver, and we see the left liver lobe over here.
Okay, just show us where cranial is, please.
This is the cranial side surface. Here we will go to see the heart and the lung, and over here caudal and gas into the stomach. So here the next view, longitudinal epigastric view, when we come to the right side of the patient.
So we see the left liver lobe is a little bit larger. Again, cranial is over here, is the diaphragm.
And some parts of the heart we can see.
And some parts of the heart we can see, that's true. Okay, let's get on to the next picture.
So again, liver parenchyma. Do you see this tiny structure over here?
Yes, it's something special.
The cardia of the stomach. So we have fundus over here and the cardia. But now we deal with the liver parenchyma.
We concentrate on the left liver lobe again and take the next picture, please. Yes, and there is a new structure over here. I'm sure you can guess what this is. It's
The aorta.
Yes.
In front of the lumbar vertebra over here.
Beautiful picture. So let's get on. Now we will show you a video clip of this view of a longitudinal epigastric view. The left liver lobe.
It's lovely. You can see
Yes.
the heart beating over here.
Yes.
Gas in the stomach, and in between left liver lobe.
It's getting smaller and smaller. That means the transducer tilts more to the left side and back again until the median line. So that's longitudinal epigastric view.
Let's perform a scan of the liver. The liver is a quite great organ, so we need a
Systematic approach.
for scanning the liver. Can you show us how you do it?
Yes. I start placing my transducer into the epigastric area in a longitudinal position, into the longitudinal epigastric view. And I ask my patient to inhale and hold his breath. And so, Christian?
Fine. We see the left liver lobe. Very beautiful over here. On this side there's something moving. It's the patient's heart. So the cranial portion of this screen we see the diaphragm over here, left liver lobe, and the caudal border in contact with the gas-filled stomach over here.
We let our patient breathe again. Okay, then we take a sweep to see the left side of the left liver lobe and ask our patient to inhale again. And as you can see, I sweep my transducer, I tilt it to the left side of the patient, slowly, slowly, and keep the left liver lobe in the center of my picture and tilt the transducer far to the left until I can see the last tip of the left liver lobe, and then I move back again, tilt the transducer again until I'm again at the midline. In our next view, we stay in the longitudinal plane and just move our transducer to the lateral part of the patient along the costal arch.
So we can check the right liver lobe.
We can check the right liver lobe, okay? Show us where the transducer is placed, okay? Below the costal margin.
So it's an ongoing movement from the epigastric
Yes.
fluid.
Okay, the structures over here, do you want to explain?
Fine, it's a lovely picture. The gallbladder over here, liver parenchyma, and here we see the IVC.
Inferior vena cava, yes.
Okay, proceed to the next one.
Yes. So here another organ comes into our view.
The right kidney over here, and liver parenchyma. So we have got the inferior part of the right liver lobe.
So we know we are on the right side of the patient. That shows us that neighboring organs can help us in our orientation.
Do you already remember the segments of the right liver lobe on the caudal side? Segment 5 and 6.
So segment 6 is near the kidney.
Correct.
Okay, this is a video. I have to start it again, please. Thank you. So we begin and see a lot of gas over here. Yes, but
There's the liver, the right kidney, diaphragm.
And we go from the lateral side of the patient to the median line.
Gallbladder over here.
And more to the left liver lobe. See the heart pumping? Okay.
So we know the patient is alive.
So this was a longitudinal subcostal view.
Very pretty.
Diaphragm over here. Can you show the diaphragm?
This bright structure on the cranial side of the liver. So diaphragm. So, from the left side to the right side of the liver. The patient is placed on his left side, raised the arm above the head, and we go on with the scan of the right liver lobe.
I place my transducer again in the epigastric area in a longitudinal position. And now I perform a sweep to the right side of the patient. Since the liver is a quite large organ, we cannot scan it at once. So on a first sweep, we focus on the cranial parts, and on our way back, we sweep the caudal parts of the liver. Okay, please inhale. I start to move my transducer to the right side of the patient, and I focus on the diaphragm so that I know that I have the cranial parts of the liver in my view.
You have a perfect view on the diaphragm here. This bright hyperechoic line over here. Brilliant.
I don't change the axis of my transducer. I let my patient exhale now and inhale again, please. And on my way back, I focus on the caudal rim of the liver. I have to apply some pressure to get good contact.
Keep the caudal liver border in mind over here.
I'm sweeping back until come again back to the midline of the patient. We got the transverse view now, the transverse epigastric view, and place our transducer in the epigastric area, as I showed you on the torso before. And see what?
Now we are always on the left side, so we see the left liver lobe over here.
And even the last tip of it over here, yes. Which is very important to see really the tip of the left liver lobe in order not to oversee some masses or tumors.
Again, we see some parts of the stomach. There's gas inside. And over here, a very lovely picture of the pancreas.
Okay, but that's a later chapter. Okay.
So we go on.
Again, the tip of the left liver lobe over here, and the inferior vena cava.
Over here.
Over here.
Can you show us the very left liver segments again in the second plane?
Yes, certainly. I start from this longitudinal position again, and now I turn my transducer slowly anti-clockwise into a nearly transverse position, but I have to adjust to the left costal arch. And I ask my patient to inhale and hold his breath. And then here we got the left liver lobe in the other plane, and I slowly tilt my transducer and perform a sweep left liver lobe until to the very last tip, and slowly sweep back again so you can easily observe the tissue over here.
You've already seen the heart. Do you want to perform an echo?
Nearly, yes, but actually we're really very close to the heart with these liver segments over here. Next, we proceed to the oblique subcostal view. We place the transducer shortly under the costal arch in an oblique position, means parallel to the rib arch.
So we can detect the confluence of the liver veins, the portal vein, and the gallbladder.
These are three important levels to document. We start with the first one, the confluences of the liver veins.
Here we see IVC and 3 liver veins, the middle one, the left one, and the right one.
And remember, the middle liver vein is our border between left and right liver lobe. Okay, next is a video. Again, confluence of the liver veins.
IVC over here.
And
diaphragm.
Next is the level of the portal vein over here. And as you can see, there's some difference between liver veins and portal vein and branches, because the portal vein has got clear white borders, whereas the hepatic veins don't. Show us again, please. Yes.
So here the liver vein, nearly no border, and over here bright echo around the branch of the portal vein over here. So you've already seen the porta hepatis in the last video clip, and here you have this view.
The level of the portal vein.
Or this picture.
This is a video clip.
IVC, portal vein.
with clear white borders around it.
Common hepatic bile ducts on the back of this structure, anterior. Okay.
Next picture. It's a video again.
Okay.
And now we proceed downwards, caudal, and see the gallbladder over here. Would you please start it once more?
So, gallbladder.
Yes, over
The
here.
structure. Portal vein and more caudal gallbladder. In the next scan, in the cross scan, we will see some interesting landmarks. Can you show us?
I'd love to. Actually, this is my favorite part of the liver scan. I place my transducer in the epigastric area, adjust it to the right costal arch. Then I ask my patient to inhale. The nose of the transducer is pointing towards me. Then I tilt the transducer steeply upwards. And then I perform a sweep slowly downwards, slowly, until I get to see this structure.
Great.
You can exhale, thank you.
You got a perfect view on the liver veins.
Yes. It's beautiful, isn't it?
Is it? It is. There are 3 liver veins, the left one, the middle one, and the right one, and the confluence to the vena cava inferior over here.
Somehow it looks a little bit like a bunny to me.
Yes, you are correct. Some say it looks like a star, the star of the liver veins, but it's a bunny.
And actually, the more it looks like a bunny, the higher the likelihood for liver congestion. But this we will discuss in our chapter of liver pathologies.
After we have seen the confluence of the liver veins, we proceed with the transverse scan, and I think we are going to see the next animal.
Yes, please take a deep breath. I just continue my sweep downwards from the confluence of the liver veins, slowly. I proceed until I see this structure over here. You press the freeze button.
So perfect. You scanned the porta hepatis, but you can also say this is a jumping deer, which is jumping over the vena cava inferior over here. So we have the body of the deer, which represents the portal vein and its branches, over here and over here. And you can even see the bile ducts on the back of the deer very nicely. So, great picture.
Now let's get on. Please inhale again. And here we can even see the tail.
There's something, yes, over here.
The gallbladder is coming into our view over here.
Great, so you managed also to see the gallbladder at the back of the jumping deer over here.
And now it's really looking like a deer. It's got its front legs over there, show us please. And the head and his neck and the back and jumping over the vena cava. But this is not only our second animal in our scan, but also the second landmark you should document in every liver scan you perform. And now we proceed until we can see the caudal rim of the liver. Please inhale again. Confluence of the liver veins, jumping deer. And now just tilt my transducer slowly downwards. See the gallbladder over there until I've seen the rim, the caudal rim of the liver.
Perfect. So at last we have to scan the very right segments of the liver.
Okay. We just move our transducer a little bit to the right side of the patient in the same position. Orientate on the costal arch. Ask our patient to inhale. I tilt my transducer upwards steeply to the cranial parts of the liver. And now sweep it downwards even more to see the very right segments of the liver. And here we got another structure.
The right kidney is over here. Lovely scene. Also the diaphragm. And some mirror artifacts on the other side of the diaphragm. A great picture of the right liver segment.
And I proceed my sweep downwards up to the caudal rim of the liver again.
Perfect.